Hi, I'm Zach from Corexel Sports Training, and what we're going to do today is we're going to show you how to get yourself out of knee pain and back into running using some specific protocol to test the glute medius and glute minimus. But first, we're going to show you a testimonial from John that used these exercises to his benefit to get himself out of knee pain and back into running. John, how long have your knees been bothering you for?
It's been bothering me for about 3.5 years. I've been using a knee brace 7 days a week.
Yeah. So we did 3 sessions on you and you're able to start running. You weren't able to run before.
Absolutely. That part is like a miracle right now.
John, how does it feel to be able to run?
It feels great. It really does.
So with John, the main issues he had, I mean, he was weak in so many areas. So his adductors were weak, his rec fem was weak, his hamstrings were weak. But what really stood out the most was his glute medius and glute minimus chain, extremely weak. And what you have to realize is that ties right into the TFL. So if this is weak here, the minimus attaches right into the TFL. And so what happens is the TFL chain has to overwork, and now that starts putting pressure on the IT band and also the vastus lateralis, which go right into the kneecap here. The other factor is that the glute medius and minimus is a major support structure for the entire hip extension chain here. So that means that it's going to affect the strength of the hamstrings and the glute maximus. The hamstrings tie right in the back of the knee here. So that's why this muscle here, I'm going to show you how to test it and then how to do the exercises that are going to get it strong and take it to the next level to eliminate knee pain. First thing we're going to do is we're going to test the strength of the glute minimus. So this is on the weaker side of things, 2.5, 5 pounds. And this is primarily where the athletes want to be at, 7.5 to 10 pounds with this exercise here. So what we're going to do is I'm just going to show you 2.5 pounds and how to do this exercise here. So what you have to realize is that the glute minimus and medius perform the exact same function. So they're both medial rotators. Are going to do this to your leg here, to your hip. And they're also adductors. The major difference is here, if we're trying to isolate the glute minimus, we want to internally rotate the leg, but we want to bring it out this way as we lift. So we're going to be right here. This is going to isolate more the minimus. The minimus hooks right onto the TFL, so the leverage point, the more out here, the more the harder the TFL has to work, so the harder that the minimus has to work. If we lift from here and we go more to angle behind us here, more towards hip extension, that's ultimately what's going to isolate the glute medius. So you have to do both because both are going to tie in to making that the glute medius and glute minimus adductor chain extremely strong here. So the test just works like this here. I'm going to lie on my side, I'm going to push down, and I'm going to lift up like this. That's it. And what you're looking for is when you're doing this, you are looking for compensation. So if the athlete does this exercise here in this position, then we need to make sure that they're only feeling it right into the glute minimus here, and it ties it right into the hip bone here. Right behind that is the glute minimus. So if they start feeling it in their adductors here or right in their TFL and they don't feel it at all here, you know that the athlete is extremely weak with that, and maybe you have to start with no weight. And that's how you isolate and test that exercise. So if the athlete fails that test, and if they 2.5 pounds, and if they feel in those compensations I mentioned, the TFL, the adductor chain, or just down the vastus lateralis IT band chain, then we know that the glute minimus isn't working. So immediately what I'm going to do is I need to fire up the glute medius because the glute medius isn't strong and it's not supporting the glute minimus. So I'm going to show you how we do that right now. Very simple. And I've never seen someone, they usually always feel it right into the glute medius when they do this exercise. So what you want to do is you want to get in the same position you are with the minimus. Turn yourself down, hips down. You don't want to be like this. Point the toe down and you're going to push up into the wall. So you're pushing into the wall on the way up as you adduct. So the medius works like this. When we're doing this exercise here, we're medially rotating. we're hip extending, so we're pushing into the wall, we're hip extending, and then we're abducting at the same time. And those are the three functions of the glute medius. So when you combine all three, that's what ultimately is going to isolate the glute medius when you do that. And that's why this exercise is so effective at firing up the glute medius. Then once that glute medius is fired up, now the glute minimus now can be strengthened to a higher level, and now you have those two functioning properly, and that's ultimately what's going to take the pressure off the knee. So I'll do this exercise here initially for maybe 2 weeks, get the glute medius strong, and then I'll go back into the glute minimus and strengthen that up. And that's primarily what I focus on in the glute minimus chain once the glute medius gets activated, because if you're doing general strengthening exercise, that glute medius is going to get a lot of work, but the glute minimus is the thing that's going to really lack as the athlete progresses. If you enjoyed watching this video, please subscribe to our channel and also like this video. Every Thursday we're going to be putting out a new episode under the playlist titled Educational Episodes. The episodes will be on sports training and also rehab, so you're going to learn a lot of variety of tools in order to improve your athletic performance and also heal injuries.